Hi there, I'm Rafael Reis and me and my colleagues Raquel, Shiroma and Luiz Lima performed our project in order to show ibuprofen, an over-the-counter non-steroidal anti-inflammatory drug, life cycle strategic plan. Please feel free to contact us if you have doubts about our presentation. In a paper published at New England Journal of Medicine by researchers from Indiana University School of Medicine, the authors were looking for compare ibuprofen low dose, high dose, and acetaminophen. In a randomized double-blind trial, 184 patients received either 2400 or 1200 milligrams of ibuprofen or 400 milligrams per day. The major outcome included pain and disability scale of Stanford Health Assessment Questionnaire. The authors concluded that in treatment of osteoarthritis, the low and high dose of ibuprofen and acetaminophen were similar. Regarding the treatment of headache, a randomized double-blinded clinical trial was performed. 729 patients received a single dose of 200, 400, or 600 milligrams dose of ibuprofen liquid gel. Pain intensity was assessed using a standard 4-point categorical scale at 15 and 30 minutes and hourly until 24 hours. The authors concluded that ibuprofen liquid gel relieved the pain, ancillary symptoms, and limitation of activity of migraine. To evaluate the analgesic and antipyretic efficacy and safety of ibuprofen compared to acetaminophen in children and adults, a meta-analysis was performed. 85 studies were included in this study. The author concluded that ibuprofen is as or more efficacious than acetaminophen for the treatment of pain and fever in adult and pediatric population and is equally safe. Regarding pharmaconomics of non-steroidal anti-inflammatory drugs, this study showed that the average patients taking non-steroidal anti-inflammatory drug a risk of hospitalization of 1.3% and the risk of death is 0.15%. This paper supports the use of the simple analgesic as the preferred therapy of osteoarthritis, especially when its lower cost and low incidence of adverse effects are taken in consideration.